Welcome back to Students Friendly, all about study. Now we'll move to a new class. Once again, back to Students Friendly.
Now we are going to discuss about level of prevention. What do you know about level of prevention? You know about prevention? First we can move to prevention, then we can move to level of prevention. Prevention is the action aimed at eradicating or eliminating or minimizing the impact of disease and disability. Prevention is the action of the action aimed to eradicating or eliminating or minimizing the impact of disease or disability. They say prevention. Prevention is the action aimed at eradicating, first one, eradicating, then eliminating or minimizing. This is the main three words are here: eradicating, eliminating and minimizing. Okay, prevention is the action aimed at eradicating, eliminating or minimizing the impact of disease and disability. These three words why this is discussing the prevention. Prevention is the action aimed at eradicating, eliminating and minimizing the impact of disease or disability. Disease or disability. Prevention is aimed at eradicating, eliminating or minimizing the impact of disease and disability. Next we can move to the level of prevention. The level of prevention, the 4 steps are there in the level of prevention. Next we are moving to the level of prevention. The level of prevention, 4 steps are there. These 4 steps wise only we are making the prevention. The level of prevention, 4 steps are there. Prevention means it's eradicating, eliminating and minimizing the disease and disability. The level of prevention, 4 steps are there. The 4 steps, now we can move to 4 steps. The 4 steps are primal and primordial prevention, primary prevention, secondary prevention and tertiary prevention. First one, primal and primordial prevention. The second one, primary prevention. The third one, secondary prevention. And fourth one, tertiary prevention. Okay. See, level of prevention. Level of prevention, first one, primal and primordial prevention. Second one, primary prevention. Third one, secondary prevention. And fourth one, tertiary prevention. Then first we can move to primary or primordial prevention. First we can move to the primal or primordial prevention. Okay. Level of prevention, primary, primer and primary, secondary and tertiary. Now we will move to discuss about the primal and primordial prevention. The primordial prevention is defined as the prevention of risk factors themselves, beginning with a change in social and environmental conditions in which these factors are observed to develop and continuing for high risk children, adolescents and young adults. Here what we are discussing is primordial prevention is defined as the prevention of risk factors. Prevention of risk factors. It's a primal or primordial prevention that's mainly aimed as to the risk factors. It is the prevention of emergence of risk factors in the population in which they have not yet appeared. Okay. Primordial prevention is defined as prevention of risk factors themselves, beginning with change in social and environmental conditions in which these factors are observed to develop and continuing for high risk children, adolescents and young adults. It is the prevention of emergence of risk factors in populations in which they have not yet appeared. It is the prevention of emergence or development of risk factors in countries or population groups in which they have not yet appeared. When they have not yet appeared also, we are trying to prevent the risk factors. The main intervention in primordial prevention is through individual and mass health education. The main intervention in the primordial prevention is through individual and mass health education. Primordial prevention is relatively a new concept in receiving special attentions in the prevention of chronic diseases. Primordial prevention is relatively a new concept. It is a new concept. Okay, here primordial prevention means it's preventing the risk factors, and then they will say it's a new concept. Okay, example of this primordial is the obesity. Okay, obesity is one of the example for like this prevention. Many adult health problems have their early origins in childhood because this is the time when lifestyles are formed. Then they will say this is the time the livelihood is starting, so we will more concentrating and remove or prevent the risk factors. Primordial prevention begins in childhood when health risk behavior begins. Okay, here we are saying primordial prevention. Primordial prevention is, it's defined the prevention of the risk factors. This is the main point in here. Say risk factors prevention only the main thing in the primordial prevention. And primordial prevention is defined as the prevention of risk factors themselves, beginning with change in social and environmental conditions in which these factors are observed to develop and continuing for high risk children, adolescents and young adult. It is the prevention of emergence of risk factors in population in which they have not yet appeared. It is the prevention of emergence or development of risk factors in countries or population groups in which they have not yet appeared. The main intervention in primordial prevention is through individual and mass health education. Primordial preventions are relatively new concept and is receiving special attention in the prevention of chronic diseases. Many adult health problems have their early origins in childhood because this is the time when lifestyle is formed. That is primer or primordial prevention. This is the main thing is the prevention of risk factors, and it is a new concept. Then second we can move to primary prevention. Next, primary prevention. prevention can be defined as the action taken prior to the onset of disease which remains the possibility that in the disease will even occur. So primary prevention can be defined as the action taken prior to the onset of disease. Prior to onset of disease. Primary prevention can be defined as the action taken prior to onset of disease which removes the possibilities that the disease will even occur. The onset of disease possibilities. Okay, see, primary prevention can be defined as the action taken prior to the onset of disease which removes the possibility that the disease will even occur. That is primary prevention. In primary prevention, we have some interventions. The interventions are in the two ways. The primary prevention, we have some interventions. These interventions we are seeing in the two ways only. One is the health promotion ways. First, the intervention way is a health promotion. Then second way is a specific protection. Primary prevention means it's an action taken prior to the onset of disease which removes the possibilities that the disease will even occur. That is a primary prevention. In the primary prevention, we have some interventions. These interventions are divided into two ways. First one is the health promotion ways and second one is the specific protection. Health promotion wise interventions and specific protection wise interventions. In the health promotion wise, first one is the health education. Health promotion wise, first step is the health education. Then second one is the environmental modification. Environmental modification. Then next, nutritional intervention. Nutritional interventions. And the last one is the lifestyle and behavioral change. Lifestyle and behavioral change. Primary prevention means say preventing prior to onset of disease possibilities. This having some interventions. These interventions we divided into two ways. The two ways, first one is the health promotion and second one is the specific protection wise. In the health promotion included health education, environmental modification, nutritional intervention, then lifestyle and behavioral change. These are the points included in the health promotion. The health promotion included health education, environmental modification, nutritional intervention and lifestyle and behavioral change. Then we can move to specific protection. Then we can see which are all the specific protection interventions. First one is the immunization. First one, immunization. Second one, chemoprophylaxis treatment. Chemoprophylaxis. Second one is the chemoprophylaxis. Then third one, use of specific nutrients. Use of specific nutrients. Use of specific nutrients. Then protection against occupational hazards. Protection against occupational hazards. Then control of environmental hazards. Control of environmental hazards. Next, safety of drug and foods. Safety of drug and foods. This is the specific protection. The specific protection include immunization, chemoprophylaxis, use of specific nutrients, protection against occupational hazards, control of environmental hazards, and safety of drugs and foods. The primary level of prevention having some interventions. That interventions are health promotion and specific protection. Health promotion included health education, environmental modification, nutritional intervention, and lifestyle and behavioral change. Then the specific protection included immunization, chemoprophylaxis, use of specific nutrients, protection against occupational hazards, control of environmental hazards, and safety of drug and foods. These are the interventions included in the primary prevention. Next, we can move to secondary prevention. Next, we will move to secondary prevention. The action which the progress of diseases and its impatient stage and prevent complications. The secondary prevention. The secondary prevention, what they are mentioning in the action which halts the progress of disease. The action which halts the progress of disease and its impede the stage and prevent complications. Okay, the action which halt the progress. Once the progress is occurred means we need to cross the progress and we need to cross the complications also. That is the secondary prevention. The action which halts the progress of disease. That means once the disease is progressing means we need to cross the progress and we should prevent the complications. Okay, that is the secondary prevention. The action which halts the progress of disease and impedes the stage, prevent the complications. And objectives. The objectives is relating to the secondary prevention. Complete cure and prevent the progress of disease. It's a first objectives we are seeing. The objectives of the level of prevention. First one is the complete cure. Complete cure and prevent the progression of the disease process. Second one, to prevent the spread of disease. You see, first one is the complete cure. Second one is the prevention of spreading. Prevention of spreading of the diseases. To prevent the spread of the diseases by occurring all the non-cases. The third one is the to prevent the complications. Prevent complications. To prevent the complications and sequence of disease. Next, to shorten the period of disability. Next objective is to shorten the disability. Yes, disabilities occur means the period of disability should shorten. The objectives are complete cure and prevent the progress of disease in process. First point. The objective of secondary prevention. Secondary prevention means the action which halts the progress of disease and its impatient the stage and prevent complications. In that objectives, first one, complete cure and prevent the progression of disease process. The second objective is to prevent the spread of disease, to prevent the spread of diseases by occurring all the non-cases. Then third, to prevent the complication of, to prevent the complication and sequel of disease. Then the last one, to shorten the period of disability, to shorten the period of disability. The interventions are individual and mass case finding measures. Individual and mass case finding measures. Then screening surveys. Then selective examinations. Here interventions. The three interventions. First one is the mass case finding. Mass case findings. Second one is the screening surveys. Screening surveys. Then the last one is the selective examination. Okay, the secondary level of prevention objectives are complete cure and prevent the progression of disease. The second one is to prevent the spread of diseases by occurring all the non-cases. Then next one is to prevent the complications and sequel of disease. Then to short the period of disability. And this is secondary prevention having the interventions are mass case findings, then screening surveys. The third one is the selective examination. Secondary prevention attempts to arrest the disease process, restore health by seeking out unrecognized disease and treating it before irreversible pathological changes take place and reverse communicability of the infection diseases. Secondary prevention attempt to arrest the disease process, restore health by seeking out unrecognized disease and treating it. Then we can move to tertiary prevention. Now we discussed the secondary prevention. In secondary prevention, objectives and interventions are important. Now we will move to tertiary prevention. Next we will move to tertiary prevention. Already we discussed primary prevention, secondary, primordial, and now we will discussing the tertiary prevention. Tertiary prevention is used when the disease process has advanced beyond its early stages. Tertiary prevention, when the tertiary prevention is going on means it is used when the disease process has advanced. The disease process is advanced. Its stage is a advanced. Okay, advanced beyond the early stages. Advanced beyond the early stages, the term only this term of prevention. It is defined as all the measures available to reduce, all the measures available to reduce or limit impairment of disabilities and to promote the patient adjustment to intermediate conditions. Okay, tertiary prevention means it is defined as all the measures available to reduce, all the measures are available to reduce or limit impairment and disabilities and to promote the patient adjustment to irremediable conditions. Let's say adjustment to irremediable conditions. That is the tertiary level of prevention. It is used when the disease process has advanced beyond its early stages, and it is defined as all the measures available to reduce or limit impairment and disabilities and to promote the inpatient adjustment to irremediable conditions. Okay, in this tertiary level of prevention, we have some intervention. That intervention should accompany the stage of tertiary prevention are disability limitation and rehabilitation. Disability limitations and rehabilitation. That is the intervention in the tertiary prevention. The disability means any restriction or lack of ability to perform and actually in the manner. Okay, the disability means here some locks are there. Okay, any restrictions or lack of ability to perform the actual manner. Okay, disability in the tertiary prevention interventions are disability limitations and rehabilitation. Disability means it is some restrictions or lack of ability to perform the actual manner. And rehabilitation is combined coordinated use of medical, social, educational and vocational measures for the training and retaining the individual to the highest possible level of functioning ability. So rehabilitation is little bit important. Here what it means, it's a restriction or lack of movement to normal manner, that is disability. In here rehabilitation means, in the rehabilitation is a combined coordinated use of medical, social, education and vocational measures for the training and retraining the individual to the highest possible level of functional ability. Rehabilitation is the combined coordinated use of medical, social, education and vocational measures for the training and retaining the individual to the highest possible level of functioning. Highest possible level of functioning is the main function of the rehabilitation. Here medical, what they are doing in the medical. Okay, first one is the medical. In here medical, restore the body function. Medical, that's the restore the body function. Restore the body function. Then second one is the vocational. In vocational, here what they are doing is a restoration of the capacity to earn a livelihood. In the vocational, what they say means capacity to earn. Say restore of the capacity to earn. Okay, capacity to earn a livelihood. Then social. In the social is the restoration of the family and social relationship. Social relationship in the family and society. Then psychological. Okay, here this is the restoration of the personal dignity and confidence.
And confidence. Level of prevention, primordial, primary, secondary and tertiary level of prevention.